Good evening, Central Indiana. Welcome to Porch Time Live at JTH Construction Studio. Tonight we got the good doctor, and Dr. Applegate is back in studio. It's been a while. We will talk to him. I got people messaging me already, Doc. That's the way it is, isn't it? Real quick, let me talk about my sponsors. Welcome to JTH Construction Studio. Get a hold of Joe Hankins for all your construction needs. 763-913-8599. Hello, Mr. Fields. Hello, Angie. Hello, Teresa. American Basement Solutions, Mr. Larry Ralph Sr., 1-877-409-2837. Fathom Real Estate, Teresa Messmer, and she's on here with us, 765-341-8911. Get a hold of Teresa for all your real estate needs. Wellspring, Mr. Bob Goodrum's Group, 765-342-6661. Hello, Angie. Stids Comfort Systems, 765-346-0195. And there's Mr. Applegate popped on there. Hello, Cheyenne. Livewire, Tommy Walls, 765-792-4012. I know I make people uncomfortable when I call them out, but that's... Trapper Tim's Nuisance, Wildlife Removal, and Pest Control. Best name in business, I'm telling you. 1-765-913-7553. Logan's Cosmos, she'll be in later tonight, 765-318-3388. Doug Allen, 877 Cash Now. That's what I'm talking about, Doug. Hello, Tanya. Wayman's Furniture Appliance and Mattress, 765-342-4339. The Yard Barber, Andrew Payton, 765-318-4108. Hometown Nutrition, Martinsville, 765-315-0738. 2024 Peregrine Homecoming Festival, August 30th through September 1st. Get a hold of Mr. Finney at 765-318-0899. HRC Heating and Cooling. Mention this ad and receive $50 off any service. 317-535-0322. Hello, Tom. Hello, Connie. And last, Burpo's Tree Service. Jason Burpo, get a hold of him at 765-346-5948. We always like our sponsors. The more sponsors, the better. Dr. Applegate, how you been, bud?
Pretty good.
It's been a minute.
Yeah.
You were here, then you were gone, and I was like, man, you're a busy man, though.
Yep.
You located down in Bloomington now, correct?
Yep. Moved down to Bloomington. I moved my practice down there in March. I think I had March to August of 23. I had my Martinsville location and Bloomington.
Oh, so you had them both?
Yeah, and then
double dipping.
And then in August, I shut down the Martinsville one and just moved it to Bloomington full time, and then I moved down there. So
still doing the same stuff though, correct?
Yep, same stuff.
Performance, and I'll mess it up. You got to say
just performance physical therapy.
Just performance. There's so much to that. You. What's up, Corey? Hello, Chelsea. Hello, Nick. You've been on several times and explained what you do. In a nutshell, could you do that for us one more time in case we get some new viewers?
Yeah, so I'm a physical therapist and a strength coach, and I take a more fitness-based approach to physical therapy and rehab. So I primarily work with athletes and adults who are active.
That rules me out right off the bat.
No, it doesn't. No, it doesn't.
I'm out, Doc.
Or if you are like an adult who is trying to lead a more active lifestyle, and maybe you have some like pain or injury that's preventing you from doing that, I also work with that person. It's mostly people who have like goals that they want to get. Like they're not just coming to physical therapy because their doctor sent them to me. Like they have something that they're trying to
specific
achieve.
Needs.
Yes. Like that's who I want to work with. That's
like a Spartan race.
Spartan race, yeah. I have worked with some distance athletes, yeah. But
very cool.
For the most part, it's like weightlifters, barbell athletes, and then like high school athletes. So
how you doing, Eli? Hello, Debbie. Hello, Mike. But you're on here for a specific thing tonight, something that you obviously want to get into.
Yeah.
And I will turn it over to you, and I'll just listen, and like I always do, and be like, because I don't know what he's talking about.
So as far as ACL injuries go, a majority of football players or like high school athletes, they know somebody who has torn their ACL. There's about 25,000 ACL surgeries performed annually in the U.S. In the U.S., and that's just in the U.S. And out of the 25,000 that are performed, only about 55% fully make a full return to complete participation.
Really?
Yep. And part of that has to do with early return to sport, meaning these athletes who have the ACL reconstruction, they go through the surgery, they go through rehab, and then they get discharged at 6 months by their surgeon and physical therapy stops. And then they're just kind of like, yep, have at it. And there are some like qualitative tests, meaning like we look at somebody jump, we look at how far they can jump. How far they could jump would be like a quantitative measure, but there's some like eye tests that we can do to kind of give somebody a readiness factor or a readiness rating. But there's a lot of room for error when you do that. In terms of like how we would want to assess somebody, you got to have some very objective measures. So we do what's called dynamometry, where we use like a strain gauge. And we can measure force in newtons or like foot pounds.
Sure.
And you can compare it side to side. There's a thing called a limb symmetry index, where before you return to sport, we want at least 90% equivalence in like knee extension strength. And this is the like brass tacks, nitty gritty side of things. Like we let the numbers guide the data rather than like an eye test.
Well, I want to ask you this. First of all, explain, and I know you can, what the tear of an ACL is and how do you fix that?
So your ACL is a ligament that basically prevents your shin bone from translating too far forward. 70% of ACL tears are non-contact injuries.
Starting and stop.
Which means, they're like running, they try to plant and cut, and the load that goes through the ACL is more than what that athlete can handle, so the ACL ruptures. When it ruptures, it has to be surgically repaired. There's newer evidence that's showing that with bracing protocols, we can actually reach similar outcomes to surgery or to somebody who had surgery, but it's a 2-year, like it's a long game that you're playing with that. So but they go in, they surgically repair the ACL. The patellar tendon graft used to be the most common one, and that would be where they would take like a little piece of bone from your tibia, which is your shin bone, and then they would take a little piece of bone from your kneecap, and then they would drill little holes where the ACL should attach, and then those like bony ends are basically plugs, so you get like bone to bone fixation, so it would be like a stronger graft.
Okay,
does that make sense?
Yeah.
Okay.
Hey Cody, how you doing? Hello Patty, hello Christine, hello Angie, hello Jeff, hello Wendy, Darlene, Mike, and Debbie. How you doing, PJ? Let me catch up here. Good evening.
You're good.
Kevin, you're wearing me out trying to keep me up. Who's first? Second? We'll get to that. Can you explain Adrian Peterson, what he did?
So Adrian Peterson is like the
freak.
Yeah, anomaly.
Yeah, because he was back in 6 months, 2,000 yards.
Yeah,
so broke the record.
He is the extreme outlier. Like he's a professional athlete who has
physically fit, unbelievable.
So like baseline level of fitness was like prior to the injury incredibly high. Mm-hmm. Has the injury. He's a pro athlete, so he has no other obligations other than like
to get back on the field.
Yeah. So he has unlimited amount of resources, and that is his job.
Yeah.
To rehab that ACL.
That one, and then Schwarber, I still don't understand to this day, because if you remember that injury, if you're a Cubs fan, second game of the year, Fowler explodes, rolls into his knee and blows everything.
Yeah.
He sparks him in the World Series Game 7.
Yeah.
There's no way.
Again, like
Schwarber's not physically fit though.
Well,
he
is a professional athlete with an unlimited amount of resources.
Sure.
Like when that
put everything into him.
Yeah, when that is your entire job. Like if you're a pro athlete and you have an injury, when you're injured, your job is not playing. Mm-hmm. It's getting healthy again.
Right.
So you have like, sports dietitians, you have an entire rehab team, like
everything he did was regimental at that point in time.
Yeah, everything's controlled. That's the only thing they focus on.
That's the two big ones I can think of.
You're not a high school athlete who is going to like 6 a.m. weights.
Yeah.
And maybe not eating breakfast beforehand, and then
Right.
going to class for 4 hours, and then you have lunch, and then you go back to class for another 4 hours, and then you go to practice after school, then you have homework. You know, it's like
These guys live it.
yeah, that it's complete. It's very hard to. It'd be like comparing apples to zebras.
Yeah.
Like
It's not but I mean, but when you think about knee injuries, those are in my mind, as sports figures, that's the first two that comes to mind. I'm like, how in the world did Adrian Peterson do that?
And that's I think that's part of the problem is like people will maybe like a kid has an ACL repair, and then like everybody knows Adrian Peterson came back in 6 months.
If that, yeah.
Or,
So
or
Schwarber,
sooner.
same thing, yeah.
Yeah, so it's like they'll take these pro athletes and be like, oh, it's a pretty short turnaround. Meanwhile, they don't have the same resources that the pro athletes do.
Right.
You know, so with ACL tears specifically, if for an athlete, if they return to sport prior to nine months, they're 7 times more likely to have a secondary knee injury. So that means they could re-tear their ACL they just had repaired, or they can tear the ACL of the opposite leg, or even like a meniscus tear. It's just a secondary knee injury.
The only thing I did was I got rolled playing ball, and this was softball, fast pitch, and the doc said that it just took them all and stretched them. He said, which is worse than a tear, pretty much. He goes, take a bunch of rubber bands, and he goes, and then it's going to take them a long time to go back. So they put me in the walking cast and I hated that.
Yeah, I would say like, how long ago was that?
Yeah, 1987, 88.
There's been quite a few changes to.
Yeah. Well,
ACL
the guy was as big as a house, and he's like, we need to check your right knee to see how it works. And I wouldn't do it, and he snapped my leg open like a chicken bone to get me to move my right knee, which I couldn't understand that to this day. But then he tried to move my left knee, and I yelled out a war cry. And he's like, okay. No MRIs, nothing, you know what I mean?
Yeah. Very different, like, nowadays.
Gil Sayers would still be playing football if that's the case from back in the 60s. So, yeah, technology has improved.
Yeah, and just, like, approaches to, like, how we manage certain conditions.
Yeah.
Like, open heart surgeries, they're getting up the same day.
See, that's crazy.
That they had open heart surgery. Like,
that is crazy.
We don't immobilize as often as we used to.
Wait a minute. My knee started hurt once I got fat. Nick, I'm sorry, Doc. I should put I don't have our foolishness up here. Kevin, someone snapped your knee. Someone rolled into me. I'm sorry, Doc.
You're good.
It's just. Hello, Corey. Hello, Lauren. Hello, Matt. All right, so you look at healing in a totally different way than your average medical people.
I would say I have a little bit more freedom to guide the rehab process the way I want to, just because I like the way my practice is set up. Insurance companies are gonna.
I don't know where she works, Lorraine. I didn't know you did that.
Yeah. Yep. So they're like it's early mobilization is associated with better outcomes. Like,
really?
Kind of across the board. Yeah. Like we don't. There are some surgeons who still lock the knee in extension after an ACL repair for a week, but there's like more surgeons that are moving away from that.
St. Francis. Okay.
Yeah. I observed Dr. Williamson at St. Francis's Surgery Center, the one in Mooresville.
Yeah.
I think I watched like 4 knee replacements and then 2 total shoulder replacements.
Would you had an intern there?
It was just during my my clinical rotations my first year at PT school. They had this sheet of paper, and it was like learning opportunities. Just check off what you want to do. So I got to watch like a bunch of joint replacements, and then I got to stand at the head of the table during an open heart surgery. So I watched open to close. It was pretty
that's no fun.
Valuable.
That's not high on my list.
So.
ACL meniscus total knee replacement. Oh wow. Yep. She covers all the fun stuff.
Yeah.
All right, tell us a little bit about what you want, reconstruction, all that. Well, what would you do?
So, depending on when an ACL gets to me.
Okay.
So if they came in, like week one of their surgery, like the goals of rehab are change based off of like the phase of their rehab. So like early on, we're working on like making sure that they have full range of motion by 2 weeks out. Yeah, that's Dr. Williams.
Yeah.
I can't remember if it was Williams or Williamson.
Yeah.
But it was like early on in rehab, it's focus on
how you doing, Corey?
making sure that range of motion is full by at least like week 2. The earlier we can get range of motion, the
So
better.
you're right on it.
Yeah, we're like trying to move the knee in both directions as soon as possible within some like minor limitations. But after range of motion is full, then we start to progress strength. The issue is that that with the early return to sport is that these ACL patients are getting cleared to go back to sport when in reality they're not ready at all. Like they don't have that limb symmetry index. They don't have like confidence in their own leg. There's other factors like other objective criteria that we want to base our like return to sport process on.
Sure.
Part of that includes force plate testing, where I didn't bring it with me because I didn't know.
You're going to force me to do something, weren't you?
It would have been fun to see. But
he's always threatening this on me.
But through the force plate testing, like we can do a battery of different jump tests, and that can show us like how each leg is being loaded. So if an athlete favors one leg when they jump, and let's say they had a right ACL replacement, and when they jump and when they land, they're producing like 30% less force through the surgical leg. Like that's an issue. That's something that we want to address before you return to sport. Right?
Okay.
Like we can identify all these different factors.
Makes sense.
To help build a profile for an athlete to make sure that they are truly ready to return to sport after the ACL repair. Like no secondary injury is 100% preventable, but we can significantly reduce the risk of a secondary knee injury by following some different guidelines. But
how many? I hate even asking this. How many patients you got right now working knees?
Just knees in general.
Yeah.
Like 16.
Are you kidding me?
Yeah, knee pain's fairly common.
Okay.
Like so shoulder pain.
It's not just ACL repair. Yeah.
Right. Like I use the force plates a lot. Like I just recently got them within the last like 2 months. So I've been, incorporating them more and more into the rehab plan. But it does give us like a very objective measure. So like the other ways that we test strength is like I push and they push. And it's kind of like if I'm stronger than somebody, it's not going to be an accurate measurement because I'm already just stronger than this person.
Right.
Right.
I see what you're saying.
Now, if we use like dynamometry or force plates, it's a true test of that person's strength.
Makes sense.
And it's a hard number that we get.
You're making me squeamish now. He always does. It's a fascinating field that you're in, though. I mean, and you're one of the only ones around, are you not?
One of the only ones with force plates. That's for sure.
Really?
Yep. Force plates and dynamometry. Nobody else has the tech that I use. So
well, let's get it out there right now. What is your address down there?
5006 South Rogers Street.
So you're down by South Rogers.
Yep. It's in the Iron Pit gym. So like my office is located in the Iron Pit.
Okay.
Yep. And I've got, if you get on my Instagram, there's some recent videos of me doing force plate testing with some of my athletes.
I saw that.
Yeah. So, one of my athletes, she's in Thailand right now. She's a weightlifter. She is part of Team USA. This is like the last Olympic qualifier, and she's already. It's not 100% official yet. It will be official Wednesday after she competes. But she's going to the Olympics. So. And
you got her back on track.
I'm her physical therapist, so like all the aches and pains.
So why aren't you in Thailand?
Things well, I'll be going to Paris, so.
Oh, will you with?
Yeah,
I guess you'd have
I'm not going to be part of like Team USA, but I'll be going as like.
You got to get your red, white, and blue jacket or something.
Yeah,
they got to get you on the team.
But there's a big like long process to
sure
become part of like Team USA's medical staff. But I'll be there like the week before she competes.
Are you shooting for that though? Is that a goal?
to get on Team USA's medical staff?
Yeah.
Probably not at this point because I don't know.
You'd probably have to give up your own practice, though, wouldn't you?
It would be a lot more of a time commitment than.
Don't they train out in Colorado Springs? A lot of it.
They have different training facilities.
Yeah.
But yeah, they train out of Colorado Springs. They go to Marquette University for some different. Like they've got the huge force plates that are like half the size of this table.
Really?
That are like laid into the floor, so they can do some like testing that's higher level than what I can offer. But
that's interesting. Is this new technology?
Nope. Force plates have been around forever. Like I used them in my undergrad as part of my I was in exercise science with a biomechanics focus. So.
I never heard of them. That's why I was like,
it's basically a plate with they're called piezoelectric crystals. So they measure force distribution on like a triplane.
So you jump on them,
and it's a like a metal plate, and then those crystals are like inside the
So it's going to measure the plate. The force you hit the floor with from both points, both feet, both sides.
Yep.
And that's going to tell you structural what's going on a little bit.
So we can get a good idea of like a you'll have a side to side comparison. So like this is where the ACL repair rehab comes into play. Like if somebody is doing jump testing and they're underperforming by like they have an asymmetry of 10% or more, like we're going to hold off on return to sport. Like they're not ready yet.
Right.
But yeah, through jumping on the force plates, we can get like an objective measure of the leg's ability to produce force, the leg's ability to absorb load, how quickly can you generate force through that leg, which is important if you're thinking about like running and being able to plant and cut, or change directions.
Basketball, soccer.
Yeah, it gives us all of this data. So like data-driven decision making is what I call it.
The linebacker for the Colts, they traded him. He had a leg injury, and I can't remember what it was. Maybe been hip, but they said that he came back too soon, and you could see the physical difference in his legs. Yeah,
so there's a lot of atrophy that happens after an ACL repair. I don't know what the Colts player's injury was.
I can't either.
But there's definitely a significant amount of atrophy that occurs. So even like week 1 of surgery, you're already seeing
that quick.
Yeah, atrophy happens really quickly. Like that's why like bed rest, like people who older adults who go into the hospital, they try to keep them out of bed as much as they can because the effects of bed rest are severe and rapid. Like they set pretty quickly. So
and to overcome those takes a while.
You lose strength much faster than you develop strength. Like it takes.
Wish that was the same way for weight, Doc.
It's something like for every 24 hours of bed rest, you lose about 7% of your overall strength.
Really?
And it's compounding. So if you've got somebody who's in a hospital and they're laying in bed, 12 to 16 hours a day, and they get their like 1 hour of rehab while they're there.
It's irrelevant.
Yeah. I mean, it does help keep them from, declining. But
you're talking zebras and apples, though.
They're getting more
numbers.
They're getting more than like an hour. Like they'll have an hour of physical therapy. They'll have an hour of occupational therapy. Then a lot of hospitals have like a walking program. So they'll have like certified walkers. So it's just somebody at the hospital that comes, gets a patient out of bed, walks them around, and then they'll put them in a chair so they're upright, which is better than being laying down. So.
All right, walk me through it. I'm a D1 athlete. I'm 30 years old. I'm going to the gym playing with 18-year-old kids. I still think I can hard cut. I blow my right. I feel like I blow something out my knee. I go to the doctor. It's an ACL.
Yeah.
They fix it up. They put a new one in. They send me. They say I can go here, but I decide to go to you.
Yeah.
And what are you going to do? Tell me how you're going to fix me.
So weeks 1 through 3, you'll see me 3 times a week. During the first week, we're mostly just doing some like quad activation exercises So part of the surgery is you'll have a nerve block, depending on if you have like what's called a femoral nerve block versus an adductor nerve block.
Why does that sound painful?
It's so that it's not painful.
Okay. Okay.
But part of the issue after the nerve block is that it becomes very hard to like get the quad to fire afterwards because of the nerve block. It's less difficult if they have the adductor nerve block because they hit a different nerve. But the first 3 weeks we're trying to restore full range of motion. We're trying to get some quad activation, some straight leg raises as best we can. Once we get to like week 4 and range of motion is full, we drop down to 2 times a week, and we're doing just progressive strength training essentially.
Is there anything I could be doing in the off time?
Yeah, so I
give
give people homework. So
yes, you do.
They're moving the knee a lot in comfortable amounts. Like a little bit of discomfort's okay. Like there is going to be some stiffness, but yeah, the goal early on is to get the knee moving and stay within some certain restrictions. Like sometimes, depending on the surgeon, depending on the way that they repair the ACL, they might give you like a don't go past 90 degrees of knee flexion till after week 2. It just kind of depends on what the surgeon wants.
Right.
But yeah, range of motion early on. Once range of motion's full, then we can transition to more of a strength training focus. And we're basically just building strength with compound movements where it's like multiple muscle groups going at once. Then we also want to do some isolated movements as well. One of the things that I would say most like ACL rehab programs are missing. There's this exercise where you sit and you straighten your knee out against resistance. Have you seen like a seated knee extension machine?
Sure.
Okay, so that exercise has been like vilified.
Why?
In the rehab world because they'll say that it puts too much strain on the ACL.
Isn't it working all the muscle groups right there?
It's working the quad, which is like a pretty important muscle group for ACL rehab. But there's more strain on the ACL when you're walking than there is during that seated knee extension. So I incorporate seated knee extensions early on. It might be against some protocols.
You're not afraid to go against the grain, though.
No, because it's well documented that there's less strain during a seated knee extension than there is during like ambulation or walking. So if they're cleared to walk and weight bear, they're cleared to do a seated knee extension.
Right.
And we are really trying to strengthen the quad back up and the hamstrings. Like the hamstrings, the ACL and the hamstrings, they do the same thing. But the hamstring is it's a contractile tissue. Force production capabilities in the hamstring are way higher than what an ACL can do. So
I'm glad you know all this.
We want to strengthen both the hamstring and the quad. I'll say like it's not all about the quad, but it's about the quad. So
if it was considered severe, what is a guess at full recovery time compared to normal therapy time?
9. So if you're trying to get back into sports, like you're waiting 9 months. So there's time based and there's also like objective based criteria. So you've got Adrian Peterson, who got done in 6 months and was like he met all like objective criteria to return early.
And then he went and broke the league rushing record that season.
Yeah, was it 3,000 yards?
To 27 or 3,000.
Yeah,
something
crazy.
Stupid, yeah. I mean, come on. Steve Austin, bionic leg out there.
Yeah.
It's
but
crazy.
I would say depending on, the rate of return of strength, you're looking at like 9 months to 14 months. So, and like rehab doesn't necessarily always come from physical therapy. Like strength and conditioning coaches are also rehab professionals. They just have a different role in the rehab process. Like they're not doing any kind of diagnosing from like an injury or pain perspective. But like Evan Sitzman here in town, he's at PRT. I don't know if like people know about his gym as much, but he's like the one that I would trust the most with any patients of mine, just any patients at all, or like family members, friends who are looking for like personal training. Like he's the guy that I always say, you gotta go check him out. But
is he still over?
Yep,
Behind the cave?
They're behind the cave.
Yeah.
Yep.
Okay.
I don't know if their building has signage yet. It's been there a while, but you can find them on Facebook. But
I want to catch these up.
Yeah.
I got down to 170. I was competing in all Spartan runs, but cancer made it where I couldn't continue to work out. But now I just need to re-motivate myself. Keaton, what's up? Connie. Oh, I'm 70 and get muscle knots and tight muscles around my knees and back and thighs that are quite painful. I do massage and grassing.
Yep.
Do you have any exercise suggestions?
Any kind of squat would probably help you out. It's so chasing knots. Like, I know knots are uncomfortable. I like going after knots, trying to eliminate muscle knots is like going down a rabbit hole. Like, you're chasing a symptom and you're not chasing a cause of pain. Like,
Cramping for some reason.
well, it's not so. Knots and trigger points are like wildly misunderstood. Like, we actually don't have a great understanding about what these trigger points or knots are. There are people who have no pain, but have these like trigger points and knots. So
that's
like
odd.
there's studies where they take Botox, which is a like, it paralyzes the muscle,
right.
and if they inject Botox into a trigger point, you would expect it to relieve pain, right? No pain relief. So that's where I don't try to break up muscle knots or adhesions. Like, we actually aren't breaking up your tissues. Like, if your tissues were that pliable and you could, break your tissues up, you would be having some real problems,
Right.
like, just through daily activity. But my main focus is like just getting people to move more comfortably. Yeah. So generally, if they're having some kind of pain, it's usually a mobility restriction or a strength deficit, and it really depends person to person. So I always recommend that they have an assessment done.
Right.
Whether it's
you always stress that.
Yeah, whether it's me or it's somebody else. Like, you got to have, I would say, a movement-based assessment, not a poking-based assessment. Like, people can try this at home. Do you have any shoulder pain right now?
I don't.
Okay, so you would be the perfect one to try this on. If you have somebody push on your shoulder right back in the center, I can come around there and poke on you. It's gonna hurt. That doesn't mean that you have problems.
I wouldn't think.
Right, that's part of the problem. So if we're just chasing knots,
I see what you're saying.
You're going down a rabbit hole. It's like these places
saying.
Are just uncomfortable in general.
Okay.
So
millions can cause problems go away quicker is what he meant, is what Nick's saying. Throw money at it. And that's true. Professional athletes have all the money and they have the best of the best and they can get rid of it a lot quicker.
Yeah.
You still do the
dry needling?
Oh.
Yeah. Yeah, again, like
this is where I check out. And he's going to do this to me on air at one time.
I'm still up for that if you are.
No, I am not. I've never been up for it.
I wonder if I can like show this video.
You can probably point it towards the camera. Yeah.
Give me a second.
You had a gal from here, or a couple you were working on dry needling, and they would get on here every time and say, "Dude, he's working wonders for me."
Yeah.
It works. It's not that I don't like it.
Let me find this video. It works really well for like TMJ disorders, but this is what it looks like.
Some muscle cramps be due to lack of
the camera.
You're perfect
there?
right there.
Okay.
I mean, seriously, hang on. Sarah. We'll get you. Hang on.
I don't know if they can see this.
Yeah. It's delayed that far.
Oh, well, hopefully they can see this.
Yeah, no, I got it here.
Okay.
Here, I'll show you. Put that back up there.
Oh, whoops.
See that?
Okay.
And what is that doing? Can you talk us through that?
So basically we take stainless steel needles and we stick them into the aggravated tissues. Those needles are 0.25 millimeters in diameter.
Doesn't matter.
They're smaller than the lead in your mechanical pencil. Are
they smaller than a tattoo needle?
Yeah.
Okay, I'm off total no, but I'm still in the no.
But basically all it does is it activates a bunch of your body's like natural pain relieving processes.
Okay.
So it opens a window for us to, exercise. Like if the goal is to build strength and you're having, pain, that is preventing you from building strength or being able to exercise.
But like you said, there's a difference in pain. You're going to get lactic acid in your muscles anyway.
Lactic acid's not a source of...
But you're going to feel sore, tightness in your muscles the next day, correct?
From the dry needling?
No, from
exercise? Yeah, but it's not lactic acid.
What caused that?
It's a buildup of hydrogen atoms.
See,
and then also well, it's not necessarily the buildup of hydrogen atoms. Like that burning that we feel, that we get told was because of lactic acid.
Right.
That's actually because of a buildup of hydrogen atoms that are like a byproduct of metabolizing lactic acid.
Dude, you just changed everything on
The
me.
soreness that you have the next day, that is from the mechanical strain of exercise. Like when you lift weights, your muscles are like, they're being torn, like micro tears are happening, and then your body lays down protein to repair the muscle. That's how our muscles get...
Tear it down, build it back up.
Yeah, that's more associated with the soreness than lactic acid is.
Really?
All the foul poles that I ran in baseball in high school to help get the lactic acid out after...
Right.
No.
Hang on, we'll get back. I'm going to catch up here. Sarah says, could some muscle cramps be due to lack of vitamins, minerals, magnesium, potassium?
Yeah, they could. I like Element packets. It's LMNT. It's like $40 for 30 of them on Amazon, but they work really well. People
I take magnesium right now and some D3.
It has 200 milligrams of magnesium, 1,000 milligrams of sodium, and then I can't remember how much potassium it has. It might have like 250.
Yeah.
But
I wish it would have worked for Andrew Luck, right? Kyle says he had ACL reconstruction about 2 years ago.
Yeah. So, I don't know if he has any knee pain or knee problems at all, but if he does, like you're probably below like where we would want him to be at this point. Like he needs to get into some form of routine strength and
Would you be able to pick that up on the plates pretty quick?
Yep. So if he came in for an assessment, I would put him through a force plate test, or like a battery of force plate tests, and then we would also hop on the dynamometer to get a measure of his...
It's not 100%, that's for sure. He needs to come in and see you and do the force plate test then, shouldn't he?
Yep. So
get a hold of him, Kyle. Nick's probably talking about the dry needling.
Nope. DOMS is that it's delayed onset muscle soreness. So that's like the soreness you feel the next days after you work out.
And you're saying that's from hydrogen?
No. That's from the mechanical
okay, I got you.
Stress and strain of working out.
Okay. Dude.
We used to think the soreness was because of lactic acid.
Yeah.
Yep.
I'm old school, remember.
Lactic acid is buffered within 20 minutes of discontinuing exercise.
Really?
Yep. You can go work out and then sit down. It will still buffer. It will still like metabolize itself out of your system. If you do light cardio, it just happens a little bit faster. So like if you do a cool down, that helps buffer the lactate a little bit faster, but it's going to get buffered either way.
I hope you don't mind. We're bouncing everywhere.
It's fine.
But people are fascinated by what you do. They always have been. Proteins. Is it better? Now, this might be stupid. Is it better for me to eat the eggs and eat the turkey and eat the chicken, whatever, than take the stuff at GNC or whoever's? Yeah, you know what I mean.
The stuff in GNC. What is it called? It's a protein supplement.
Okay, so it's not a true supplement.
Supplement what?
It's supposed to be protein.
No. Like what does it supplement? Supplements your diet.
Food.
Yeah.
Correct.
Yeah. So like a majority, you're going to be more satiated. Like you're going to have more enjoyment out of the process if you're eating food.
Right.
If you're just
you're not
shoveling down
on the supplements.
So supplements are fine.
Yeah.
But they are to supplement. Like they shouldn't be
replace
the entirety of your plan. Right. Like I try to tell people like get as much of your protein as you can through food, and then if you're struggling, then we can add in a protein shake. Like if you're drinking multiple protein shakes a day, there's nothing wrong with that. I just think it's more sustainable and more fulfilling.
Eat about 8 eggs, you'd be good to go.
I eat 5 every morning for breakfast.
I know you told me that. Yeah,
but.
How well does the insurance company cooperate with your style of recovery?
If you have an HSA or an FSA, you can use that for the therapy services. I give people I give them super bills. So the amount of reimbursement they get, it varies. It could be 80%, it could be 20%. It's everywhere in between. It really just depends on their plan. Everybody's got different plans. So
back to the protein. What's your knowledge best food to eat for protein? Is it meat?
Pick the one with fewer legs.
So chicken.
Fish.
Well, okay, got me there. The damn thing swim.
Lean proteins. Your lean proteins. So like pick the one with fewer legs. So fish and eggs, good protein sources. Chicken is a good protein source. Beef is a good protein source. Just get like lean beef. Yeah, you can get some like pork tenderloins that are like pretty low fat, high protein.
Reba. Hi, Kevin and Mr. ACL. That's Dr. Applegate.
That's funny.
That is Dr. Applegate.
That's all right.
Hang on. Sorry, I just joined in, getting to know everybody. Good evening, y'all. I love watching this broadcast. Come on, Kevin, you can do this. Suck it up, Buttercup. We love you. I'm older than you, not Coney dogs. I love you too, Reba. And no, I'm not doing it. What about state insurance like HIP?
It's zero reimbursement for that. If you're on HIP, you have to go to like one
they'll pick out.
Mm-hmm. So
they could go to you, but it'd have to be.
They would have to
totally fund it by themselves.
Yep, it'd be all self-pay. So.
Right. Hello, Michelle. If anybody wants to come in and do dry needling, he would come in and do it on air. I'm telling you right now. He's offered that, I don't know, 100 times on here. You had a couple gals that were doing it. I think carpal tunnel. One of them had.
One of them was carpal tunnel. Another one was like neck pain and headaches.
Right.
So.
And did you get her on the road to recovery?
Mm-hmm.
Good. She hadn't been on for a while, so maybe she got her neck fixed and took off.
I worked with her. So I was in Terre Haute, and she drove to Terre Haute for me to work with her.
Wow. So she was dedicated.
Yeah.
That's a haul.
But like I have people that drive from Terre Haute to work with me right now. And then I had somebody that flew in from Texas.
Really?
Yep.
Well, you're top notch, bud. You could be on the Olympic team here for too long. And you have someone on the Olympics that you're training or working with.
Yeah, I'm the rehab person. So
that's phenomenal, man. Come a long way. Bouncing around the state, but you're getting there. I will do this live. Reba, really? What ailment you have, dear? Tell me. This could be interesting. This could be a groundbreaking show here.
Yeah.
You still up for doing it live?
Yeah.
Reba, tell us what you got. Tell the doc what
as long as I feel like it's appropriate for what she has. Yeah.
Yeah. I've got a hang now. Can you stick me with needles? That's not happening. You know my situation with my hip and stuff. That's totally different. And when I seen that pop up, that's just something that's a totally different. I couldn't do any. There would be no needling with that.
No, I would have you do other stuff.
Yeah.
I mean, we could do needling for pain. It would only be for pain relief, which that's all needling is for anyways. Mm-hmm. Like it's not fixing any underlying causes of pain.
Okay.
It's just reducing pain
so
that we can
work
do
that
the
area.
stuff that's going to make you better long term.
So. I get that. Absolutely had a complete hip replacement in 2010.
Yeah. So she would have to have her hip exposed.
I'm not exposing my hip on air. Sorry.
As long as she's cool with that would be.
We'd have to set a gurney up and everything in here.
Yeah, I would have to like bring my treatment table, and we would have to like drape with some towels.
Would it be easier to come to you and go live with it?
Yeah,
I'd be interested in that. Yeah. As long as it's not me and I can look away, we're good. Because my face won't be on camera. Mm-hmm. It'll just be the actual. We'll focus right down on the area.
Yeah.
Reba, you get a hold of Doc. And then if he feels it's something we can do and get by without crossing too many lines. And
if it's a hip replacement, like she probably just has a glute tendinopathy that's flared up a little bit.
You fire that off like I know. Oh, yeah, the glute tendinopathy. Yep. Yeah. Hell, I should have thought of that.
If it's like pain on the outside of the hip or like close to the tailbone, either of those, it can be a aggravation of the glute. So.
Yeah. Reba's good.
Yeah.
Reba will get a hold of you.
It's a fun time.
Yeah. Anything else you want to cover on reconstruction of the knee?
Mostly, if you have an ACL repair, or if you're a parent and your child is a high school aged athlete and they have an ACL repair, I cannot stress enough that you need to wait beyond 9 months at
Before you
least.
get them out there.
Yeah, you can make the return to sport time a lot quicker if you're incorporating some like routine strength and conditioning, but that needs to be guided by a strength coach or somebody like me that's a PT and strength coach. Like, they don't need to jump into like HIIT workouts or like Zumba, things like that, or CrossFit. Like, CrossFit's good. All those exercise methods are good, but if you have an ACL repair, like, you need to be doing a structured, what we would call like periodized and also individualized strength plan. So,
is it true if we get over 30 grams of protein in one sitting as a waste, your body doesn't absorb it at all?
Nope.
You can eat all you want.
Yeah, you can eat. So,
do you believe in the what is it, the protein diet?
the carnivore one?
Yeah.
I mean, I don't like any diets that are like restrictive. Like carbs aren't a bad thing. Like, especially if you're an active person, like, you need carbs for your fuel source. Like, you gotta
They
have
ignite
carbs.
it, don't they? Yeah.
Yeah, that's like when you're out exercising, you're doing a lot of activity, your primary fuel source is carbohydrate. Like, you gotta have 30 to 40 grams of carb like 30 minutes before our physical activity. And then
Strenuous exercise. No?
even distance activity, like, you want carbs.
Really?
Yeah, that is your primary fuel
Even
source.
in a weight loss
Yeah,
situation?
you still want carbs,
Okay.
but you're gonna reduce the amount of carbs that you're taking,
Well, I've
and then
reduced it.
the timing of things is going to be different. Like, you still want fats when you're trying to lose weight. Like, 75 grams of fat in a day, it's not that much. It's not a lot. That's what I meant.
Sounds like a lot to me.
That's what I meant. It's not a lot.
That's a lot of fat. So eat the ribeye with the big chunk of fat on it.
You gotta eat to lose weight. Like, you have to eat to lose weight.
I understand that point. Yeah.
So, and when you start restricting things, that's when when the sustainability of whatever plan you're going on, like, it becomes a lot more challenging. So,
I'm telling you, he's good. Tell people how long you've been doing this. I know people think you look like you're about 22 still, Doc, and married and the whole 9 yards. How you pulling that off?
I work out pretty regularly.
Watch his videos on Insta. He's insane. He still does it.
But would you ask me? Sorry.
How long you been doing this? You've been doing it a while.
Okay, I started my undergrad in 2012. So that's 2012 to 2019 was when I was in school.
Yeah.
So it was school for 7 years, and then I've been practicing since 2019. So 5 years, so 12 years altogether in terms of like education and practice.
You're no rookie.
So
what's the address again? 5006 Rogers?
Yep, South Rogers.
South Rogers. That's down by Logan Shop, actually. Get a hold of Doc. He's on Facebook. He's on Instagram. I just set my diet to 55% protein, 25%. There you go.
I would do like, instead, which it might end up being 55% for him. I don't know what he weighs, but like, the goal would be to get to at least a gram per pound
of protein. Now, how is that possible though?
So
that's a lot of
it's a lot
protein.
of food. I get around 180 grams in a day.
Protein?
Yeah. So I'm eating.
Kidding me?
I'm eating like 5 times a day.
See, one of my best workout buddies ever in the military. He was about 5'3", I swear, and that's all the dude did was eat 6 times a day, little meals. He'd have to eat 260.
Yeah. So I mean, it's one. So the minimum like recommendation is 0.8 grams per kilogram.
1 to 1, then, yeah.
And like, Americans barely get that. Like, they barely get the minimum. So then to get to those like upper thresholds, it's like 1.8 to 2.7 grams per kilogram. Like, those are the guidelines in terms of like increasing your protein intake. Now, if somebody's at 1 gram per kilogram and they want to get to 1.8, they don't just jump from 1 gram to 1.8. Like, your stomach is not going to be happy. So you gotta scale it up. So, like,
what do you mean I can't eat 10 cheeseburgers in one day?
Let's use 260 real quick. So 260 divided by 2.205.
How many eggs would that be?
There's like 6 grams of.
Yeah, I thought it was a little over 5. Yeah.
Yeah. So 260 divided by 6, 40, 50, 45.
How many eggs a day do you eat? Just 5?
5. Yeah.
That's it. You don't eat them again the rest of the day.
Yeah, I buy the big plastic crate of like 30 eggs.
You need chickens, bud. I'm telling you.
117 kilos.
He's at 255 a day. Holy cow.
Yeah, so if he did 1.8 times 117, that's at 210. So if he's doing 255, what did I just say?
1.8.
Hold on. He's 117 kilos. Okay. 255 by 117. He's at 2.1, so he's in a good threshold.
Okay.
Like, he's doing pretty good. Like, that's somebody that would be putting on, like, trying to put on mass.
But he's trying to lose weight.
So
he's trying to drop weight.
Yeah. So then we have to consider like total calories consumed. Okay. So like he's hitting a good protein goal. So it's preservation of lean mass while he's like trying to lose weight.
They said that's what protein shakes help. Right.
Yeah. So like 255 grams of protein. If you're getting that all through food, like you're eating a lot.
Ashley says Premier protein shakes, they are lifesaver.
Yeah, they're like 30 grams of protein. You can buy like a 20 pack from Sam's.
How many calories? Do you know?
120.
So not bad at all.
Yeah, most protein shakes are like 120 grams of protein.
Any carbs or sugars?
120 calories. Do what?
Carbs or sugars in those a lot though? Yeah, you'll yell at me about the carbs, but you know what I'm trying to do, so I know I need them.
Yeah, not in most of them. Like Muscle Milk has one that's 25 grams of protein, 0 grams of sugar. I think Premier Protein has 0 grams of sugar as well.
They are low sugar. Wow.
Yeah.
I'll look into that. I do need to increase at 1400. I need to increase the protein, but I don't want to go too much higher than where I'm at because I feel good and I'm maintaining.
As long as what you're doing, like you feel good and you're like losing weight the way you want to.
Yep.
Like keep on it. Like stay on that plan until your weight loss plateaus.
Yeah.
Then you can then make another change.
Yep.
Where you might increase your protein intake.
Right.
Like.
But how do you? But your calorie count's going to go up too, though.
Yeah, but
not in significant steps.
You can reduce in other areas. Like it also depends on like what you're getting in other areas.
I'm telling you, Doc, I'm living off of sarcasm, coffee, and chicken right now, and that's it.
It's probably not sustainable.
Whether it be eggs or actual chicken.
Yeah.
And I eat hamburger patties, no bun, onions. That's it. Honestly. Very low sugar. Michelle has tons here at the house. That's what she drank for a past years. They're very good and tasty.
I know people put Premier Protein shakes in their like iced coffee.
Really?
Instead of using milk as like a creamer.
They have pumpkin spice.
Yeah.
Don't tell them that. They'll be yelling at me when we get off air.
I'm probably the most like lax person you'll find in terms of like when it comes to weight loss or like improving your health.
Pumpkin spice is yuck. Shout out Dakota. What's up? What's up, brother? Is he do to me?
What's up, brother?
Right. Oh, now he'll start with it. That's that's Logan's boyfriend. He'll be here directly if they're not out in the parking lot. The best is the peanut butter cup. Now we're talking, Ashley. Now we're talking. Oh my gosh. We've went to the pit here. So I will keep you informed of what I'm doing because I appreciate what you do. I think you're one of the most down-to-earth medical people I've ever met in my life.
I think just the problem that people make is they're like so polar in their efforts. Like they go
cold turkey one way or the other.
They implement very strict changes very quickly. And it's just not sustainable.
But that's how I am. I mean, I'm either all in or all out. And I was all out for a long time. Then when my brother passed, I went to the Army with him. I know exactly what happened to him with his knee.
Yeah, he
had reconstruction in '88. Chris, how's it going? He's upstate New York. Oh, he might be in Minnesota now. Yeah, I think he's upstate. Good dude. How's the knee? But he ran around Germany with it limping that leg the whole time. I did get it fixed.
ACLs heal too, so that's where like the bracing protocols come into play, and like you can have a fully functioning knee
Right.
without having surgery, but it's a long game.
But
So.
he was in the Army when I was in, so it was get the mallet and the hammer out. We're gonna fix it. I think he had surgery when he got back to the States. I don't think he had it over in Europe.
Yeah.
But Doc, we need to have you back in again. Need to check on if she goes to that needle point. Let me know, and if we can do it, we'll do it. If not, we'll have you back in a little bit, a month or so, and pick another topic and advertise a little better. I had clips on my mind for the last 3 weeks. So, did you get to see that?
Yeah.
Enjoy it?
Yep. I watched it out front of my apartment building. So.
Yeah. I was told if it was complete tear, it wouldn't heal, and I had a quad graft.
Quad graft is newer. So.
What is that?
They take a piece, like a portion of your quad, and use that as the new ACL.
Healed great, held up for 30 years in Heidelberg. Wow, I did not know that. So he's still going strong then. I didn't know he had it done in Heidelberg. I was gone though. I think I was out by the time he got his knee. He used it as a crutch. Sissy. All right, Doc. Anything else you want to close with?
Nope.
Talk about?
That's it. So.
Let me know on the needle point. If we have to come down, we will. I'm fascinated to see it. Not saying I'd ever do it, but I'm fascinated to see it. Appreciate you. Thanks for tuning in. We're going to cut this and then come back on here in a little bit with Shelf Care with Logan, her fabulous book show that people love. Love you guys, Docs. Thanks for coming in as always. We will see you here in just a little bit.